Cervical spondylosis, often called neck arthritis, is a common age-related condition. It affects the vertebrae or bones and discs, which are the cushions in the neck. Over time, these structures wear down, leading to changes that can cause pain and stiffness. Imagine the wear and tear on a car tire over thousands of miles. Just like the tire, our spine experiences wear and tear as we age. This condition is a normal part of aging. It rarely progresses to a point where it causes serious problems. However, when symptoms do occur, they can range from mild to severe. These symptoms include neck pain, stiffness, and headaches. In some cases, cervical spondylosis can also cause numbness or weakness in the arms and hands. While cervical spondylosis is typically associated with aging, certain factors can increase your risk. These include previous neck injuries, poor posture, smoking, and obesity. Recognizing the symptoms and understanding the causes of cervical spondylosis is the first step toward managing the condition and maintaining a healthy, active lifestyle. As we age, the discs between our vertebrae begin to lose fluid and become thinner. This process, known as disc degeneration, is a natural part of aging and a key contributor to cervical spondylosis. Imagine a grape gradually turning into a raisin. That's similar to what happens to our spinal discs over time. This loss of disc height reduces the space between vertebrae, increasing the likelihood of friction and bone-on-bone contact. Additionally, the ligaments, which are tough bands of tissue that connect and stabilize the vertebrae, can also become stiff and less flexible with age. This stiffness further contributes to the development of cervical spondylosis. These age-related changes in the spine can lead to a range of symptoms, from mild discomfort to significant pain and restricted movement. Understanding these changes is crucial for recognizing the early signs of cervical spondylosis and seeking timely medical attention. While age is a primary factor in cervical spondylosis, several other risk factors can contribute to its development. These factors can accelerate the wear and tear on the spine, making individuals more susceptible to this condition. One significant risk factor is previous neck injuries, such as whiplash from a car accident or sports-related trauma. These injuries can cause immediate damage and increase the likelihood of developing cervical spondylosis later in life. Similarly, occupations that involve repetitive neck movements or prolonged periods of poor posture, like desk jobs or construction work, can also put excessive strain on the neck, increasing the risk. Other risk factors include genetics, smoking, and obesity. Genetics play a role in the strength and structure of our spines, while smoking can damage the discs and reduce blood flow to the spine, accelerating degeneration. Obesity puts extra stress on the joints, including those in the neck. Cervical spondylosis often presents with a variety of symptoms, ranging from mild discomfort to more debilitating pain. The most common symptom is neck pain, which can vary in intensity and location. Some people experience a dull ache, while others describe a sharp shooting pain. Another frequent symptom is neck stiffness, making it difficult to turn the head from side to side or look up and down. Imagine trying to turn a rusty hinge. That's similar to how neck stiffness can feel. This stiffness can make everyday activities like driving, reading, or even holding a conversation uncomfortable. Headaches, particularly those that originate in the back of the head and radiate towards the forehead, are also common with cervical spondylosis. These headaches often worsen with neck movement or prolonged periods of holding the head in one position. Section 5. Age-related variations in symptoms. While cervical spondylosis can affect people of all ages, the severity and specific symptoms often vary with age. In younger individuals, the condition may be asymptomatic or present with mild, intermittent neck pain. However, as we age, the symptoms tend to become more pronounced and persistent. As the degenerative changes in the spine progress with age, the risk of nerve compression increases. This compression can lead to symptoms like numbness, tingling, or weakness in the arms and hands. These symptoms often start gradually and may worsen over time, affecting daily activities like writing, gripping objects, or buttoning clothes. In some cases, cervical spondylosis can also cause problems with balance and coordination, making walking difficult and increasing the risk of falls, especially in older adults. It's essential to remember that age is just one factor influencing the symptoms of cervical spondylosis. Other factors such as overall health, lifestyle choices, and the presence of other medical conditions also play a role. Section 6. Diagnosing cervical spondylosis, unraveling the mystery. Diagnosing cervical spondylosis involves a combination of approaches, starting with a thorough medical history and physical examination. Your doctor will ask about your symptoms, their duration, and any factors that worsen or alleviate them. They will then perform a physical exam, assessing your neck's range of motion, muscle strength, and reflexes. This examination helps determine any limitations in movement and identify areas of tenderness or pain. Imagine a detective gathering clues. Your doctor pieces together information from your history and physical exam to understand your condition. To confirm the diagnosis and rule out other conditions, your doctor may recommend imaging tests such as X-rays, MRI scans, or CT scans. X-rays provide images of the bones, showing any bone spurs or narrowing of the disc spaces. MRI scans provide detailed images of the soft tissues, including the discs, spinal cord, and nerves, helping to identify any nerve compression. CT scans can provide more detailed images of the bones than X-rays, and are particularly useful in visualizing bone spurs and other bony abnormalities. Section 7. Conservative care, non-surgical approaches to treatment. In many cases, cervical spondylosis can be effectively managed with conservative non-surgical treatments aimed at relieving pain, improving mobility, and slowing down the progression of the condition. These treatments focus on managing symptoms and enhancing the quality of life without resorting to surgery. One of the primary approaches is medication. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce inflammation and alleviate pain. In some cases, your doctor may prescribe stronger pain medications or muscle relaxants to manage more severe symptoms. Physical therapy plays a crucial role in managing cervical spondylosis. A physical therapist can teach you specific exercises to strengthen neck muscles, improve posture, and increase flexibility. These exercises, performed regularly, can help stabilize the neck, reduce pain, and prevent further damage. Section 8. Surgical interventions when other options are exhausted. While conservative treatments are usually the first line of defense against cervical spondylosis, surgery may be necessary in certain situations. If the condition progresses and conservative measures fail to provide adequate relief, or if there is evidence of spinal cord or nerve compression, surgery may be recommended. The goal of surgery for cervical spondylosis is to decompress the spinal cord or nerves and stabilize the spine. This might involve removing a portion of a vertebra, removing a herniated disc, or fusing vertebrae together to reduce motion and pain. Imagine a construction crew reinforcing a weakened bridge. That's similar to how surgical intervention aims to stabilize the spine. Surgical procedures for cervical spondylosis have advanced significantly in recent years, becoming less invasive and offering quicker recovery times. However, as with any surgery, there are potential risks and benefits to consider. Your doctor will discuss these with you in detail to help you make an informed decision. Section 9. Living with cervical spondylosis. Tips for a better quality of life. Living with cervical spondylosis requires adapting to the condition and making lifestyle modifications to manage symptoms and maintain a good quality of life. These adjustments can range from simple changes in daily routines to incorporating regular exercise and maintaining a healthy weight. One of the most impactful changes you can make is to practice good posture. Maintaining proper alignment of the head and neck reduces stress on the spine. Imagine a string pulling your head upward. That's the posture to aim for. Avoid slouching or hunching over, especially when sitting for prolonged periods. Regular exercise is crucial for managing cervical spondylosis. Low-impact activities like walking, swimming, or yoga can help strengthen neck muscles, improve flexibility, and reduce pain. Incorporating neck stretches into your daily routine can also alleviate stiffness and improve range of motion. Section 10. Seek professional advice. Your health, your priority. Cervical spondylosis is a common condition, especially as we age. While it often progresses slowly and can be managed effectively with conservative treatments, seeking professional medical advice is crucial for accurate diagnosis, personalized treatment, and optimal outcomes. If you experience persistent neck pain, stiffness, headaches, or any other symptoms related to cervical spondylosis, consult with your doctor or a qualified healthcare professional. They can evaluate your condition, determine the underlying cause of your symptoms, and recommend the most appropriate course of treatment for your specific needs. Remember, early diagnosis and intervention are key to managing cervical spondylosis effectively and minimizing its impact on your life. Don't ignore your body's signals. Prioritize your health and seek professional guidance to navigate this condition and maintain a healthy, active lifestyle.